One and all, welcome to the series of webinar organized by Faculty of Homeopathy, Parul University. It gives me a great privilege to welcome you all in this webinar series. Myself, Dr. Purav Desai, Dean Faculty of Homeopathy, and along with me, there is a team of four principals, Dr. Hina Rawal, Dr. Hitat Mehta, and Dr. B.P. Panda sir. Uh, we all four regularly organize the various webinars by calling the specialist and the legends of homeopathy to share their experience to the community. The most important part and the credit behind is about our management. Our management is constantly motivating us to conduct these kind of various academic activities so our science can progress and we can get the excellence in our science. So without wasting time, I request Dr. Hina Madam to introduce about the today's speaker. Madam, please.
Thank you, Dr. Purav sir. Dr. Pratima Pal ma'am is an assistant professor, Department of Materia Medica at National Institute of Homeopathy, Kolkata. Before joining NIH in 2014, she worked as lecturer in Burdan Homeopathic Medical College and Hospital for 2.5 years and as medical officer RBSK in West Bengal for 1.5 years. She did her BHMS from University of Kolkata and MD from West Bengal University of Health Science. She is also pursuing PhD from West Bengal University of Health Sciences right now. It is my pleasure and privilege to introduce Dr. Pratima Pal ma'am. Ma'am, you can begin your webinar.
Thank you, Dr. Hina ma'am, for introducing me. And I thank all the organizers for providing me with the platform to give this presentation today. Now, the topic of today's discussion is temperament. Uh, Edward Whitmont, a Jungian psychologist and homeopath, describes how in his student days they used to act out a pantomime called the hare in the soup. This depicted the different reactions of various individuals to finding an unwanted substance in their food. The first person flies into a rage and throws the soup at the waiter. The second person is shocked and disgusted, but shrugs it off and walks out whistling a tune. The third person breaks into a crying fit because they feel the most awful things always happen to them. And the fourth one looks at the hare, leaves it alone, and then orders another portion. This pantomime depicts nothing less than four different characteristic reactions to one and the same situation. Moreover, it depicts the reactions are pre programmed and compulsive, not elective. Thus, each individual reacts according to an innate, predetermined emotional pattern that makes it impossible for him to respond otherwise. The choleric cannot respond in a phlegmatic fashion, nor can the sanguine or phlegmatic person, even if he wanted to, work up a real affect like the choleric. Now we come to some definitions related to temperament. Temperament is an inclination or mode of emotional response, mental or physical character medieval physiology. Temperament has been defined as constitutionally based individual differences in emotional, motor, demonstrating consistency across situations and relative stability over time. Stresses links between temperament and biology. Sorry, actually, I had a cold. The term reactivity refers to the latency, rise time in the term self-regulation refers to all inhibition and Now, psychologically, temperament is classically defined as an inborn dispositional difference in the behavioral style and self regulation or variability in individual behavioral responses to external stimuli. Physiologically, temperament is conceptualized in the terms of individual differences in reactivity to stress and focuses on, for example, cardiovascular and neuroendocrine responsiveness. Now we come to the historical perspective. In ancient India, in the days of the Vedas, temperament was classified into three physiological factors: Shushka or dry, Shikta or wet, Sanchari or permeating. Later on, these were termed as Pitta or fire principle, which used bile to direct digestion and hence metabolism to venous system; Kapha or water principle, which relates to mucus, lubrication, and carrier of nutrients into the arterial system; Vata or air principle. It is necessary for maintaining the nervous system. It was believed in that time that health exists when there is a balance between the above mentioned three fundamental bodily humors or doshas, which are constantly moving in a dynamic balance with one another. These doshas were formed by a combination of five elements, that is air, ether, fire, water, and earth. In Ayurveda, these doshas are also known as the governing principles, and every living being is characterized by a dosha. In the second half of the 5th century BC, Hippocrates made a synthesis of the existing philosophical opinions from the point of view of a physician. His 58 writings were preserved in the collection Corpus Hippocraticum. The most relevant writing of these was Periphysios Anthropo on the nature of man. This is ascribed to Hippocrates' son-in-law Polybos, to whom we are grateful for the ancient humoral pathological theory. The organisms of all living creatures consists of elements that make up also external environment: water, fire, earth, and air. So there is a correlation between this philosophy and the philosophy of the Vedas. These four essential elements are in constant motion, maintaining elementary powers in a balance or dynamis. In the body, they are effective in four body fluids or humors: blood or hyma, phlegm or phlegma, yellow bile or coal, black bile or melanchol. These are bound together by four qualities: warmth and cold, dryness and moisture. Health is therefore nothing else than harmony of these four body humors, their normal composition, and thus their normal effect. Such state is called eucrasia. And when this natural balance gets disturbed, eucrasia disappears, and then we can speak about disharmony, disturbance, lost balance, or dyscrasia or disease. Galen of Pergamum used the theory of humors to explain individual differences in character. Even though his theory was based on the same four fluids, he also focused on mixing of the four. Galen's theory allowed for 9 possible temperaments based on the levels of four fluids in the body. In the four least desirable temperaments, one characteristic dominated the other three. In the four others, a pair of temperaments dominated the other two. Galen referred to these as either sanguine, choleric, melancholy, and phlegmatic. In the ideal temperament, all the four had equal balance. Now, this is a pictographic depiction of these temperaments. Yellow bile or choleric temperament is related to the liver, and it is characterized by hot and dry. Black bile or melancholic temperament is related to the spleen. It is characterized by dry and cold. Phlegmatic is related to the brain. It is characterized by cold and wet. And blood or sanguine temperament is related to the heart, and it is characterized by wet and hot. Now, over the time, in different eras, different philosophers have given different characteristics to these temperaments. Now, yellow bile is related to the choleric temperament. Season wise, it is related to the spring. Element wise, it is related to air. And organ wise, it is related to the liver. These people are characterized by courageousness and amorousness. Blood is related, or the sanguine temperament is related to the summer. Element wise, it is related to fire, and organ wise, it is related to the gallbladder. These people are easily angered. Black pile, or the melancholic temperament, is related season wise to autumn, element wise to earth, and organ wise to spleen. These people are usually despondent and sleepless. And the mucus or the phlegm is the phlegmatic temperament. Season wise, it is related to winter, element wise to water, and organ wise to the brain or lungs. They are usually calm and unemotional. Now we come to the modern theories related to personality and how they are related to the temperament. Eysenck in 1967 began with a theory of personality which he based on two super traits: extraversion, introversion, and neuroticism and stability. According to this theory, people who are highly extroverted are sociable and outgoing and crave excitement and the company of others. People who are highly introverted are quiet and introspective. They tend to prefer time alone and to be cautious in the way they plan their life. Excuse me. People who are highly neurotic tend to be anxious, moody, and vulnerable, whereas people who on neuroticism, they are calm and even tempered. Now, these are Eysenck's personality type chart. Here, we see that the melancholic temperament people are in between the emotionally unstable and neurotic temperaments. They tend to be moody, anxious, rigid, sober, pessimistic, reserved, unsociable, and quiet. The choleric temperament are a mixture of emotionally unstable, neurotic, and extroverted persons, and they are touchy, restless, aggressive, excitable, changeable, impulsive, optimistic, and active. The sanguine temperament people are a mixture of extroverted, emotionally stable people. They are usually sociable, outgoing, talkative, responsive, easygoing, lively, carefree, and they have leadership qualities. And the phlegmatic temperament, they are a mixture of introverted and emotionally stable persons. They are usually passive, careful, thoughtful, peaceful, controlled, reliable, even tempered, and calm. Now we come to some personality theories. No single theory of personality is accepted by all psychologists. The most widely accepted model is the Big F5 or the FFM, five factor model. This was introduced by McRae and Costa in 1987. These five factors are O for openness, C for conscientiousness, E for extraversion, A for agreeableness, and N for neuroticism or the ocean. Neuroticism and extraversion are similar to Eysenck's theory. Now we come to the seven factor model by Cloninger. It consists of four temperaments: harm avoidance, novelty seeking, reward dependence, persistence. The first two are similar to neuroticism and extraversion. Research has shown that the above temperaments may be associated with biased secretion of neurotransmitters, novelty seeking with dopamine, harm avoidance with serotonin. Now we come to temperament traits. So we can see here that temperament traits are seen as relatively stable behavioral dispositions and tendencies which are partly heritable and connected to certain biological mechanisms, possibly due to their neurobiological and physical correlates. Temperamental traits have been documented as playing an important role in disease. Excuse me. Sorry, pardon me. Now, there we come to the views of various stalwarts on temperament in homeopathy. Hahnemann first mentioned the role of temperament in homeopathy in his lectures on Pulsatilla and Mitria Medica Pura. The homeopathic employment of this, as of all other medicines, is most suitable when not only the corporeal affections of the medicine correspond in similarity to the corporeal symptoms of the disease, but also when the mental encounter similar states plant is suitable. Time in the patient a timid, lachrymose disposition with a tendency to inward grief and silent peevishness was good tempered and mild, or even frivolous and good humoredly waggish. Phlegmatic temperaments, on the their resolutions with rapidity and are quick in their movements, even though they may appear to be good tempered. The above portrait is happiness. Now, in Herring's analytical Ignatia, phlegmatic, kind, good-hearted, and mischievous are all related to pulsatilla. In nurse repertory, nervous timid pulsatilla, sanguine good-natured pulsatilla. So pulsatilla, though predominantly phlegmatic, has components of nervous as well as sanguine temperament too. Though pulsatilla or impulsive at times, nevertheless, it is much less indicated. During the formative years of contradictory temperament years were later introduced into 13. For a rapid or permanent cure, patient has a mild phlegmatic emotional state is glad. Ignatia will not cure if the patient's emotional state is unchangeable and not inclined to fright or vexation. This forms the basis of elimination of the unsuitable remedy by constitutional and temperamental counter indications. Aconite is counter-indicated in the mild, placid temperament because it is more suited to the plethoric, full-blooded sanguine individual. Nux vomica is counter-indicated in the mild, changeable individual because it works best in the choleric rather than the phlegmatic type. Pulsatilla is not suitable for the extroverted sanguine persons because it is better adapted to the tearful phlegmatic temperament. Lastly, Ignatia is not suitable for those who are of steady, even disposition because it works better in extremely nervous temperaments with a hysterical nature and quirky symptoms. In his book on chronic diseases, Dr. Hahnemann has highlighted Dr. Junker's observation on the difference in manifestations of suppression of skin disease according to temperament of the patient. He observed that with young people of a sanguine temperament, the suppression of itch is followed by phthisis. With persons in general who are of a sanguine temperament, it is followed by piles, hemorrhoidal colic, and renal gravel. with persons of sanguinocholeric temperament by swellings of the inguinal gland, stiffening of joints, and malignant ulcers. With fat persons by a suffocating catarrh and mucus consumption. Also by inflammatory fever, acute pleurisy, and inflammation of the lung. He further states that in autopsies of lungs have been found indurated and full of cysts containing pus. Also, other induration, swelling of the bone, and ulcers have been seen to follow the suppression of eruption in fat persons. Phlegmatic persons, in consequence of suppression of itch, suffered chiefly from dropsy. The menses was delayed, and when itch was driven away during their flow, they were changed into monthly hemoptysis. Persons inclined to melancholy were sometimes made insane by such repression. If they were pregnant, the fetus was usually killed. Sometimes the suppression of itch caused sterility. In nursing women, the milk in general lacking, the menses disappear prematurely. In older women, the uterus become ulcerated, attended with deep burning pains with wasting away or cancer of the womb. So, with suppression of the itch in melancholic temperament, these were the complaints. This document clearly shows that suppression of skin lesion causes noticeably different syndromes in each of the four Hippocratic temperaments. Rima Hanley records in Search of Later Hahnemann that Hahnemann called Reverend Everest melancholic and repertorized the rubric hypochondriacal temperament and wrote down the remedies anacardium, natrum, nux vomica, and zincum. It is thus quite clear from the above that with his deep knowledge of different writings in the medical field, Dr. Hahnemann used the knowledge of temperaments as another tool for individualizing the cases. Again, patients of the same temperament may have different presenting symptoms. From Herring's analytical symptoms of the mind and nerves repertory, we get the following. Persons of phlegmatic temperament with an obstinate, irritable, fault-finding disposition belongs to cyclamen. Phlegmatic temperament with mild yielding and good-natured disposition is pulsatilla. While phlegmatic temperament with sluggish and moroseness is lachesis. Choleric temperament, who are mistrustful when sick, are lycopodium. Choleric temperament, who are foxy and mischievous and destructive, are tarantula. Choleric temperament, especially in children, is maccarp. Choleric temperament, who are haughty, are lycopodium and platinum. Sanguine. Sanguine temperament person who is a romantic and falls in love easily is Ignatia. Sanguine and impulsive is Cicuta. Sanguine and good-natured disposition is Phosphorus. Impulsive disposition, quick and lively perceptions is Phosphorus. Choleric sanguine temperament with a malicious, irritable nature and dark hair is Nux vomica. Bilious temperament with asthma, Phosphorus is indicated. Sanguine temperament with asthma in lively subjects, again Phosphorus. Melancholic and hysterical, asthma, suffering from asthma, spasmodic, caused by anxious dreams, sensation as if clothing were too tight is Nux vomica. Bilious temperament, melancholic temperament with a tendency to constipation is sulfur. Excuse me. Simon says, how often, for instance, do we not meet with a mild, soft disposition in a patient who have for years been afflicted with the most painful diseases, so that the physician feels constrained to esteem and compassionate the sufferer. But if he subdue the disease and restore the patient to health, As is frequently done in homeopathic practice, he is often astonished and horrified at the frightful alteration in his disposition. He often witnesses the occurrence of ingratitude, cruelty, refined malice, and propensities most disgraceful and degrading to humanity, which were precisely the qualities possessed by the patient before he grew ill. Those who were patients when well often become obstinate, violent, hasty, or even intolerant and capricious, or impatient or desponding when ill. Those formerly chaste and modest often frequently become lascivious and shameless. A clear headed person not infrequently becomes obtuse of intellect, while one ordinarily weak minded becomes more prudent and thoughtful. And a man slow to make up his mind sometimes acquires great presence of mind and quickness. Am I audible? Okay. In the above mentioned cases, there has been a clear opposite shift in dispositions of the patients in health and disease, which might be due to the fact that people often possess mixed temperaments, and the shift from one temperamental state to the other entails a shifting of manifested dispositions, just as we observe in treatment of mixed miasmatic states. Bonninghausen. Now we come to the views of Bonninghausen. Bonninghausen taught that it was important to understand the natural constitution in the state of health in order to perceive what is strange, rare, and peculiar during disease. Am I audible?
Yes, madam. Yes, madam.
Okay, fine. Okay,
Yes, ma'am. Yes, ma'am.
okay, thank you, ma'am. Bonninghausen taught that it was important to understand the natural constitution in the state of health in order to perceive what is strange, rare, and peculiar during disease. Bonninghausen made it very clear in his writings that it was important to assess the physical constitution, mental temperament, and predispositions during case taking. In his article called A Contribution to the Judgment Concerning the Characteristic Value of Symptoms, he says, as a matter of course, the personality, the individuality of the patient must stand at the head of the image of the disease, for the natural disposition rests on it. He wrote that those phenomena that differs little or not at all from the healthy natural state requires little attention, but everything that differs in a striking or rare way therefrom deserves a proportionate notice. The more striking or rare these negative changes in the constitution and temperament are, the more important they become in selection of the remedy. For example, if a silent, reticent, quiet man becomes talkative, manic, frenzied, these symptoms are rare for that patient. So, it is the difference from the previous that matters, the intensity of the difference from the previous state that matters. If a chaste, soft spoken, and religious woman suddenly becomes lascivious, loud, the total opposite of her previous state, and atheistic, this is peculiar for that patient. According to David Little, at the same time, one must also judge the nature of what some call the healthy state. Was the silence of the man actually suppressed emotions that turned into mania? Was the formerly chaste woman suffering from sexual repression? For such reasons, one must look deeper into what is called health and what is called disease according to family, peers, and society. It is in such cases that knowledge of temperament is important, as it helps us to judge what is the person's innate reaction and what has been the modified reaction. Now we come to Constantine Hering. During Constantine Hering's extensive proving, special attention was given to the physical constitution and mental temperament of the provers of the remedy. This was useful because it provided examples of observable physical constitutions and temperaments during the state of health and shows how they were transformed by the provings. At the same time, it demonstrated which constitutions were affected the most by the actions of the homeopathic remedies during the provings and the clinical trials. If during these provings it was observed that certain remedies brought out more symptoms, in a particular constitutional type, these observations were recorded. These remedies were then tested in clinical trials for confirmations. This is the source of rubrics such as the following. Nux vomica is well adapted to zealous, angry, thin, bilious patients. Phosphorus is well adapted to tall, slender persons of sanguine temperament with fair skin, delicate eyelashes, fine hair, and quick perceptions and a sensitive nature. Arsenic is well adapted to over-anxious, chilly, nervous temperament. Slow, tearful, gentle temperament is morbus phlegmatic pulsatilla. Fat, chilly, costive, indecisive temperament is morbus phlegmatic graphitis, etc. Herring recorded the following dietetic constitutions and temperaments under Calcarea carb in the stages of life and constitution section of the guiding symptoms. Leucophlegmatic, light complexion, blue eyes, blonde hair, fair skin. Fat persons, fair light complexion grows too rapidly in case of tuberculosis. Nervous temperament, delicate constitution. Black hair, dark complexion, blue eyes. Nervobilious temperament, black hair, dark complexion. Climacteric years, hysterical women who have not been married and who have had profuse catamania and sanguine temperament. So we see that in Calcarea carb, uh, we commonly say that Calcarea carbs are for leucophlegmatic temperament and that is there in the double bold. But in single bold also we see that we have the nervous temperament, we have the nervobilious temperament, we have the hysterical temperament, and we also have features of sanguine temperament in Calcarea carb. The recording of the constitution, temperament, and predisposition is also applied to crisis, acute disorders, and acute miasms. For example, aconite and belladonna are well known to have deepest action on the plethoric individuals with inflammatory, sanguine temperament. Jar constitution. For example, to ailments of lymphatic constitution, pale face, blue eyes, blonde hair, freckles, disposition to catarrh, leucorrhea, or other kinds of blenuria. Cocculus is adapted to open air, scrofulous engorgements, gentle and our anamnesis. For as we study temperament closely, we see that as said by Dr. Temperament, so characteristic of Nux vomica patient, we know with positive certainty the disease to which he is predisposed, who suffered from a hemorrhagic diathesis, etc., etc. So there are other features in phosphorus. Along with the sanguine temperament, phosphorus acts well in such persons. Sanguine temperament are predisposed to these types of disease states. And when the totality of symptom agrees, phosphorus has cured many such patients. Now we come to views of H. A. Roberts on temperament. These temperaments are to a very large extent physiological, but besides the stature of the patient, the matter of temperament implies coloring, functional tendencies of circulation, elimination, respiration, and so on, and at the same time, mental and emotional tendencies in reaction to the environment and circumstances. The temperament is the basis of the congenital constitution that does not change over the person's lifetime, although it might be influenced by external influences. The morbific influences that are attracted to temperamental tendencies are amenable to treatment and can be removed by the homeopathic remedy. This in itself is greatly preventive of the dangers arising from temperamental weaknesses. So tendencies are there, and when influenced by the environment, disease results. And these disease conditions can be treated by homeopathic remedy. Correct treatment of infants and young children removes predisposition towards specific diseases before they manifest and may be considered curative and prophylactic treatment. Dr. Roberts also gave a warning. Roberts warned against jumping to quick conclusions by the superficial similarity of well known remedies to certain constitutions. A blonde, blue eyed woman with phlegmatic temperament is not automatically a pulsatilla patient. This is little more than one sided keynote prescribing without the benefit of the totality of symptoms. There are many remedies that can be suited to a phlegmatic patient depending on the signs and symptoms. Now we come to the conclusion of this discussion. Practice of homeopathic medicine is as much an art as it is a science. Science, since art is a skill acquired by experience or observation. This presentation has been an attempt to highlight the experiences of various practitioners of homeopathy through time as regards the application of the concept of temperament. This topic is vast and one so vast that it is only possible to highlight a few aspects of studying man in health and disease will help to explore temperament more fully. Thank you for your patient hearing, and I thank the organizers for providing me the platform for sharing this topic. Thank you all.
Thank you, Dr. Pritam Pal, madam. Now I would like to request our colleague, Professor Dr. Mehta, to give his concluding remarks.
Thank you, Panda sir. The topic itself is a very important utility for the homeopathic perspective and the study of the temperament, which is very essential in order to prescribe homeopathic remedy. So, madam started with the temperament as a discussion and the theory of the Edward Mitton psychologist. Each temperament which reacts differently, and with the help of the characteristic or habitual inclination, that is the constitutional based of the theory, which is very important in order to assess temperament of the individual. Then attentional reality and self-regulation, which is needed as a homeopath, and psychologically, that is the inborn dispositional difference in behavioral style, and physiologically, that is neuroendocrine, which has been responding with the patient itself, and the historical perspective, the history which itself suggests the theory of the directly it is related with the homeopathic theory, homeopathic concept, the Suska or dry, Sikta or wet, that is Sanchari or permeating, and our body is made up of 5 elements, that is air, ether, fire, water, and earth. So the 5th century, that is the BC of the Hippocrates, that is the ancient humoral theory, and that is the direct correlation with the pathological theory of the pathology, and the correlation between the Vedas and essential elements, that is blood for sanguine, heart and summer, phlegm, that is phlegmatic, brain, yellow blue, that is liver and spring, black bile, that is melancholic, spleen and autumn. So nicely description in that is health is a state of this social merely an absence of disease, and the in the state of health, that is eucrasia, when our harmonious functioning, that is the disturbing, then dyscrasia takes place. Madam started with the possible 9 theories of the temperament, that is the theory of the Galen, then the sanguine, choleric, melancholic, and phlegmatic. Then Heisnick chart was which is very informative charts. Melancholic temperament is very moody, anxious, rigid, and sober. Choleric, that is touchy, restless, and aggressive. Sanguine, that is outgoing, talkative, lively, and having very good leadership quality. Phlegmatic, that is passive, careful, and reliable and calm. So the 5 factor modules personality theory, that is ocean, that is openness, conscientious, extraversion, agreeable, and neurochiasm. So, followed by the seven factor theory of the Cloninger's theory, and the phlegmatic, that is obstinate and fault finding. Cyclamen was prescribing yielding, that is pulsatilla for the indecisiveness. Sanguine, that is romantic, Ignatia. Impulsive, Cicuta virosa, good nature, pulsatilla. Then the theory of the temperament with the disorders, that is the modern utility, was given. Biliousness, asthma, phosphorus, sanguine, phosphorus, melancholy, and hysterical, with the nice correlation with the aphorism number 210 with the footnotes, was given with the help of the people often possesses with the mixed theories and mixed temperament as per the theory of the miasm. Then Madam started with the different concept of the stalwarts. Bonningason theory, that is the understand the natural constitution in the state of the health, assess the physical constitution. Then Constantine Herring, that is extensive proving was done and attention was given to the physical constitution. Then source of the rubric, that is Naxwamika, zealous, angry, biliousness, phosphorus, that is slender personality, fair complexion and sanguine temperament, and Kalkariakar on the basis of the theory, that is leucophlegmatic, fair fat and flabby, having the black hair and dark complexion. So overall, it was a wonderful discussion with the theory of the miasm, with the individualization. So the main core of the today's topic of the madam is that the practice of homeopathic practice, that is art, we have to develop our skill and we have to faith in our science. Skill is required by the repeated experience, by the repeated observation. So we have to explore the temperament as a totality, and it is a very important tool in order to diagnose any disease. So we have to find out the disorders, we have to find out the individuality. Every person is individual from one to another. And thank you very much, madam, for your wonderful coordination and wonderful knowledge sharing session. Now I invite our principal of the Parul Institute of Homeopathy and Research, respected Dr. Panda sir, to proceed for the vote of thanks.
Thank you, Mehta sir. I am very much thankful to the management of Parul University, our director Komal madam, for giving this type of opportunity to enrich the knowledge of our students as well as our fraternity in different topics. So since the lockdown, we are conducting such type of events by the guideline of our faculty dean Dr. Purav Desai madam, Dr. Hinalal madam, and Dr. Mehta sir. Today, I am very much thankful to Pratima Pal madam for its good correlation between the temperament, diathesis, and constitution. Of course, constitution is a broad term. Inner constitution is temperament, and constitutional state is diathesis. But the way of explanation, the way of identifying the different type of temperament, the way of presentation of different view of different stalwarts of homeopath, that was very excellent. I can say as a teacher of organon of medicine, and I hope definitely Hina madam will appreciate this. So being a young teacher, one young colleague, in brief, actually what madam told, temperament, that subject is a vast subject. It is not easy to explain each and everything with example regarding temperament, but in a few minutes, that means within 30 minutes, madam explained in a nice way, and I hope this type of cooperation in future also. On behalf of our faculty, we are thankful to you, madam, again. I am very much thankful to all the listeners, those who are listening, and those who got benefit from this webinar and expect such type of cooperation in future also. I am very much thankful to the digital technician of our Parul University. Because of them, the program was being conducted uninterruptedly. I am very much thankful to all the students, to all the teachers, those who are listening, and definitely with example, with the book, with the author name, madam has stated everything. So the fourth year students, PG students, PhD students, as well as the UG student, they can refer the particular topic, because temperament is a topic of HR about philosophy. So that is a separate topic. So every stalwart they have written in a precise manner in different way, and temperance, that is the way of treatment of Parinad madam. So it is a vast topic with brief. Pratima madam explained everything. Really madam, it was excellent, and we the fraternity hope such type of cooperation in future. And again, those who are cooperating us directly or indirectly to make this webinar success, on behalf of our faculty, we are very much thankful to you. Thank you very much.
Thank you, sir.
Thank you all.
Let us complete the session.
Thank you. Thank you, Pal ma'am. We leave the session now. Thank you so much.
Thank you, madam.
Thank you, ma'am. Thank you, sir.
Okay, namaskar.